Could you please describe F1 in 3 words?
Exciting, nerve-wracking, and definitely informational.
Exciting, novel, and
Challenge.
kind of intimidating as well.
Chaos.
Trial by fire. At the start, but then it's lovely.
Fulfilling.
I think the most rewarding thing is when I've had some patients tell me that you've actually helped me a lot. You've listened to me. Patients' families actually writing letters for me or like bringing me a card. I think at the end of my first rotation, my team brought me a cake, which was really, really nice of them. So I think it's just rewarding to know you're actually making a difference.
You end up like actually knowing what you're doing, and someone can ask you like, please can you refer this person for something, or can you sort this something, sort of medications out for someone, and you know how to do it and you make it happen, and it happens, and the patient gets better or has an improvement in their symptoms, and that's because you did your job, and that's really, really fulfilling.
When you can actually see that you are making a difference, so like even just having a little chat with the patients like after ward round, and like that like sort of face-to-face care, and actually being able to put the things that you've learned in med school into practice, and see patients get better, that's definitely very rewarding, yeah.
I've done some interesting jobs so far. I think I like anything that has to do with being practical. So I think one of the coolest things and most favorite things was intubating a 16-month-old child. I think that was quite rewarding and very interesting.
It's so cliche, but it's like the patients and it's a team. Like, it's the thing that I love. Like, there's a real camaraderie that you get within doctors, I think, in the doctor's mess, and it's a really nice feeling. It's kind of like Freshers Week all over again when you see other specialty doctors that you've worked with, even in different departments, and you know, you see them in the canteen, you have a bit of banter, so you get to know loads of different doctors and work together. And I think there's an aspect of trauma bonding in a sense, right? You're in the trenches together if it's a busy on take, but that you're there, you're learning, and it's a really good environment.
I'd love to say something really like holistic, like making people better, and I do really like all of those things, but I actually just love like doing something with my hands. So I love all of the sort of like, yeah, improving people's lives and those things, but the thing that I get the most fulfillment out is if I just do a really good cannula. I feel great about it. I'm like, that was textbook, it went in, it was perfect, like it's going to work for ages. I've got a green in a tiny little vessel and I'm feeling great about it. And those are things that bring me like joy in the day if I do something well, or just getting feedback that I've made a good referral. I think, like a lot of people who end up going into medicine and doing like long stretches of academia, I respond quite well to good feedback. I think I've become more confident during F1, and I've had a couple of times where, you know, I've spotted something that no one else has picked up on yet, that someone has had an abnormal result we've not actioned, or I've sort of tied together a few things and said, hey, could this patient have this problem that we haven't considered? And I think right at the beginning I didn't really have the confidence, even if I thought it, to say that, whereas now I do.
One thing that I realized, but I stopped spending as much money just because I don't have much time. But I think I've grown as a person. I've definitely become more wise in a way. I think it's because I'm more appreciative of the simple things of being healthy, you know, able to be coming into hospital, not being in a hospital bed. You see patients who are your age and you see patients who are younger than you, which was a shock. And it makes you more grateful, you know, you're just like, I'm healthy, I'm able to contribute and I'm able to make a difference. So yeah, I've changed, I've become more wise, but yeah.
I think the biggest thing is realising that not every single request that you get from a nurse, for example, is something that you absolutely have to do right there and then. So I think this thing about triaging is really important. And I think I probably, and again, it's all a case of having, of course, the utmost respect for everyone in the MDT, but actually realising not every task needs to be done now and then, and actually the priority of tasks. I used to think that to be a good F1, you need to do all the tasks, but actually it's about doing the most important tasks first, and that's the most important thing.
My biggest piece of advice is not to really have any expectations, because half of it is dismantling those expectations.
Just be honest and be true to what you know and what you don't know. In the beginning, no one's going to judge you, no one's going to be like, oh, why don't you know this thing? Ask your seniors, make friends, the competition that is a big thing throughout medical school is no longer existent when you're an F1. So you're all in this together. No one knows everything. So make sure that you ask around, make sure you get comfortable, and make sure, your basics are there. Like, come on time, ask if anyone needs help. These basic things really make a difference.
And never underestimate asking ideas, concerns and expectations of patients and family, because that can actually help guide what your end goal as a clinician is.
I think the thing that surprises me the most about F1 is how fun it can genuinely be once you get over that workload. So as I've said before, the workload is just this rate, but if you can work more than that workload, you can really enjoy things. And there's a massive opportunity to get involved. And you go from being a medical student where you're a professional curtain puller, you're not doing much, you're kind of standing in the way. Actually, once you're actually there as an F1, you're invested, you're part of the team, you're more invested in it. So then if general surgery aren't taking a surgical patient that's on the medical take, you're more invested to actually call them and speak to them, and actually you've got the receipts, you've got the scans that show it's a surgical problem, and it's more, you've got a great sense of investment and you're more fulfilled because of that. So I think you can genuinely make an impact even as an F1, as the lowest on quote unquote the pecking order, because you can lead up that chain of command as well. And your ward team will recognise it, your consultants, your SHOs, your radios will notice it, and the whole thing will go smoother.